Hello, everyone. I'm Camille Kotton, and I'm here with Dr. Siriorn Watcharanan. Siriorn, why don't you tell us a little bit about yourself?
Hello, everyone. My name is Siriorn Watcharananan. I am a transplant infectious disease physician working at the Faculty of Medicine Ramathibodi Hospital, Mahidol University in Bangkok, Thailand. My session at the TTS 2026 will focus on donor evaluation in tropical regions and low to middle income countries. This topic is especially timely because transplantation is becoming more global. Donors and recipients may come from different epidemiological backgrounds, and infectious risk can vary significantly between regions. At the same time, transplant programs everywhere are trying to expand organ utilization to address the persistent shortage of the organs. In this session, we will discuss how transplant programs can approach donor evaluation in these settings while still maintaining the balance between safety and the responsible use of available organs.
So tell me, how do transplant programs balance donor-derived infection risk with the need to expand organ utilization?
Balancing the risks of infection with organ utilization is really one of the everyday challenges in transplantation. On one hand, transplant recipients are very immunocompromised, particularly early after transplant. So even infection that looks mild or even unnoticed in a donor could become serious in the recipient. Because of that, transplant teams must carefully evaluate donors for potential risks of infection. But at the same time, there's a major shortage of organ worldwide. If the program becomes too cautious and decline organs, whenever there is uncertainty, many patients may never get a transplant. So in practice, the goal isn't to eliminate risk completely. That's not realistic. Instead, teams try to understand the level of risk and manage it appropriately. They combine standard screening tests with donors' history and the clinical context to make the best possible decision and management. In the end, it is really about finding a practice balance, using as many as organ as safely as possible while staying alert to infectious risks.
Very interesting. So tell me, what regional factors most often change the risk assessment for you?
A few regional factors can really change how transplant teams assess the risk of donor derived infection. The biggest one is the local epidemiology. Different regions have different infection patterns, so knowing what diseases are common locally helps clinicians interpret the donor's history and lab results more accurately. Another factor is seasonality and outbreaks. Some infections increase at a certain time of the year. For example, arboviral infections during the rainy season. So during those periods, teams may be a bit more cautious and a specific screening may be applied to donors. Clinicians also look at healthcare exposure, such as recent admission, ICU stay, because those situations can increase the risk of multi-drug resistant organism. In those cases, transplant programs often have to rely more on microbiological screening. And finally, travel or cross-border exposure matters as well, since donors or recipients may have been exposed to infections outside the transplant center's region. So in practice, teams just try to pull all these pieces together: local disease patterns, seasonality, exposures, and the laboratory results to make a balanced decision about using the organ safely.
So now we'd like to talk a little bit more about practical considerations and emerging threats. So my first question would be, what should transplant teams ask or look for when donors come from tropical or resource-limited settings?
When transplant teams evaluate donors from tropical or resource limited countries, It helps to look at the situation more broadly and not rely only on routine laboratory testing. One of the first things clinician needs to check is the donor's recent history. However, many tropical infections present with very non-specific symptoms, and sometimes donors may even appear asymptomatic at the time of evaluation. It is also important to think about local epidemiology of infectious disease. In some regions, conditions like tuberculosis, multi-drug resistant bacteria, or certain parasitic infection may be more common and may not always be detected by routine screening. Clinicians need to carefully determine whether additional evaluation is needed. So, in practice, transplant teams need to put the whole picture together: donor data, local epidemiology, available test results to identify potential risks while still safely using the organ.
Excellent. Thank you. So, how do you think that programs should think about donors and recipients with cross-border exposures?
When donor or recipient have cross-border exposure, transplant teams need to avoid focusing too much on national borders. Infectious risks are often shaped more by traveling, migration, and environmental exposure than by geography alone. So, one of the first things clinicians need to look at is where the donor or recipient have lived or traveled recently, especially in neighboring regions where people move back and forth frequently. Another point is that screening practices can differ between countries, so transplant teams often need to review what testing was done and decide whether additional evaluation might be needed. They also have to keep an eye on regional outbreaks or emerging infection that might affect during that time. Overall, it is really about thinking beyond borders and focusing on exposure and regional epidemiology when assessing the risk.
Now, let's maybe talk a little bit about guidance for programs. From your perspective, what are the most important program level practices that improve both safety and utilization of organs?
At the program level, a few practical things can make a big difference for both safety and organ utilization. First, it helps to have a clear framework for donor risk assessment. Donor decisions often need to be made quickly. So, having a structured way to review donors' history, exposure, and laboratory results helps team make consistent decisions and avoid declining organ unnecessarily. Second, access to transplant infectious disease expertise is very valuable. These specialists can help interpret unusual results or infectious risks, which sometimes allow programs to safely use organs that might otherwise be rejected. And finally, good communication between transplant team, microlab, and organ procurement organization is very essential. When everyone shared information quickly, the potential risk can be recognized early and managed appropriately.
Very interesting. And tell me, where do you see the biggest opportunities for global collaboration and knowledge sharing?
I think one of the biggest opportunities is simply sharing experience and data. An example is the donor derived infection. These events may be uncommon, so a single transplant center may see that maybe a few cases over many years. When centers share cases through registry or international networks, it becomes much easier to recognize patterns and learn from each other. Another opportunity is learning from regions with different infectious disease or disease patterns. For example, clinicians in tropical regions may have more experience with infections like TB or vector-borne diseases, while programs in temperate climate or any other area may encounter different pathogens. Sharing these experiences can really help improving practice everywhere. It is also room to work together on practical guidelines for donor screening and infectious risk assessment, so programs have frameworks they can adapt to their own settings. And finally, training in infectious disease is very important as transplant programs continue to grow around the world. The more we collaborate and exchange knowledge, the better we can protect the patient and use organs safely.
Thank you very much, Sirion. I completely agree with everything that you said. I will say that regarding guidelines and international collaboration, I don't know of any better place than the Transplantation Society Transplant Infectious Disease section, as we've had really great guidelines over the years, and it's wonderful to be able to collaborate together, work together, and sometimes when I've had urgent questions about various regional infectious diseases, I've turned to the group, and it is such a wonderful group to provide excellent, timely support. So I would encourage everybody to utilize the TTS Transplant ID section even more for things like this.
For me, also for myself, coming from low to middle income countries, I think I have a privilege of joining the TID under the TTS for several years. And that give me and also many other doctors opportunity to share experience and also concern about infection that I have come across in my experience, and also perhaps working together to build up the good educational activities and also research that can help bringing up the knowledge and also the service for this particular section, and also for the younger generation of transplant infectious disease specialists and also transplant nephrologists or gastroenterologists or heart transplant, whatever, to understand more about infection that is actually broad and also unlimited. I think TTS has given me and also many other transplant infectious disease opportunity to bring up this concern. And I wish that in the futures we, as a group, and also I hope the team is better, going to build up and also contribute more of the knowledge to the society of the TTS. Thank you.
Wonderful. I was wondering, in thinking about TTS 2026, what types of abstracts and presentations are you most looking forward to seeing?
Well, I think because TTS is international, and I think TTS has given opportunity to many researchers and also doctors from around the world. So I expect that we might come across more interesting and also unexpected or unrecognized disease that we are going to learn from. And I think for the past 20 years, I have seen many of the cases from around the world, including South Asia, Southeast Asia, and East Asia. And that knowledge has actually built up the concern and also vigilance for us in terms of understanding of infection and also emerging infection. And I hope this year we are going to see more of that. And I am actually very eager to learn from all of the researcher and expert, and I'm also very excited to meet all of the experts, because I think um, transplant program face the same challenge. There are far fewer donors, and we are trying to expand organ utilization while maintaining safely. I think that's why TTS is such a valuable venue. It brings together transplant professionals from around the world and creates a space to share experiences and learn from different approaches and discuss practical solutions. Conversation like this in TTS help the transplant community continue to improve how we evaluate donors, expand safe access to transplantation worldwide. Thank you.
Thank you very much, Sirion.